Today let's discuss a topic. Why does unilateral microtia, with ear canal atresia, have minimal impact on hearing? Let's take a look at the principles of sound conduction. Sound conduction is usually divided into air conduction and bone conduction. Let's first talk about air conduction. The external ear collects sound waves and transmits them through the ear canal, delivering the sound to the eardrum. The eardrum vibrates and transfers the sound to the ossicles. The ossicles consist of 3 small bones that amplify the sound at this point and transmit it to the inner ear. The inner ear contains numerous cilia that convert sound into electrical signals. By their movement, these signals are then sent to the brain via the auditory nerve. The brain integrates this information and responds to the sounds. When the ear canal is atretic, it means the air conduction system is compromised. At this point, the second pathway, bone conduction, allows sound to be transmitted through the skull directly to the inner ear. The inner ear then converts sound into electrical signals, which are sent to the brain via the auditory nerve. This explains why unilateral microtia, with ear canal atresia, still allows us to hear sounds. Here's a reminder. If a child has bilateral microtia, with one side having a functional ear canal and the other side being atretic, it's similar to unilateral microtia with canal atresia. However, if the child has bilateral microtia, with bilateral ear canal atresia, it's crucial to use a soft band device to ensure the child can receive external auditory stimuli. After the ear reconstruction surgery, an internal bone-anchored hearing device can be installed to establish the auditory system.